Hello, everyone. I'm Taylin Washington Harmon, the clinical trials editor here at BDO. And today we're here talking about medical mistrust in clinical trials. And this is a really important topic to discuss because this is often something that I hear a lot from, readers about joining clinical trials and just basically the history of Black people in America and feeling as if they're experimented on. So I'm really happy to have our guest. Her name is Audrey Davis of Cancer Support Community, and she wrote an amazing story for us a few months ago about how her family essentially rallied around her father, who had stage 4 colorectal cancer, to encourage him to try a clinical trial that ended up ultimately extended his life for a little bit until he passed away. So I would like to really bring on Audrey. Hi, Audrey.
Hi, Taylin. Thank you so much for having me.
You're welcome. You're welcome. So, Audrey, I know you're the Senior Director of Health Equity at Cancer Support Community. Can you tell our audience a little bit about what you do and what your work is?
Absolutely. So, for those of us who are not familiar, Cancer Support Community is actually the largest professionally led nonprofit that offers 100% free 99 emotional support services to both cancer patients and their loved ones. We do this through our 196 network partner locations in about 50 markets across the US. So, this might look like support groups, this might look like one on one counseling, it might look like yoga. And we have both in person, those brick and mortar locations that I mentioned, as well as hybrid or virtual offerings for people who, if you're a cancer patient, you might be immunocompromised due to treatment. So if you prefer to log in and kind of stream as we're doing right now, you can do that as well. We also have a Cancer Policy Institute, which focuses on grassroots policy advocacy and, of course, patient access at both the federal, state, and local levels for cancer patients and their loved ones. And we have a Research and Training Institute. We do quantitative and qualitative research looking at the emotional distress and also the experience of being a cancer patient and also a cancer caregiver. It really is our mission that everyone and anyone who is impacted by cancer is both uplifted, strengthened, and we offer support, foster compassion communities, and of course, we break down barriers to care. In my role specifically, looking at health equity, I'm thinking of folks who have not only been, you mentioned some of the historical injustices, historically under resourced, but also contemporary experiences, right? This medical mistrust that we have is very much justified. There is a reason that we have a mistrust, not only for at times the healthcare system, but also for those in power who have historically and even contemporarily shown us that our best interests are not always at heart.
Right, right. That's very clear. And you made that very, very apparent in the story you wrote called A Clinical Trial Gave Me Two Bonus Years with My Dad, and everyone should have that chance. That
Mhm.
link to the story is going to be in the comments for everybody watching on Facebook. So I guess I want to start with, your uncle's role in your dad's decision making around doing a clinical trial. Like, can you elaborate on that and how important that familial aspect was?
Absolutely. So I'll give a little bit of background for folks who haven't necessarily read the piece. My dad was from Haiti, Haitian immigrant. He emigrated here with his two brothers when he was in his teens. Unfortunately, both of their parents had been killed in Haiti. And so they came to the US for better opportunity and for just a better chance at becoming successful, right? My uncle Wilfred, one of his brothers, went on to become an internal medicine physician. And so this plays a role because my dad, although he went the computer science route, when it came to his cancer treatment and cancer diagnosis, he unfortunately was diagnosed at stage 4. So for those who are on this live right now, I'm going to remind people get screened for colorectal cancer early. Don't wait until you're 50. For some of you with family histories, you may want to start to advocate at 40. Others, it'll be 45. But unfortunately, my dad had some symptoms, and as many folks do, he was kind of trying to put it off, didn't want to go to the doctor because then they were going to find something wrong with him. But when he was diagnosed, and because it was a later stage diagnosis, he was not given a great prognosis. And at the time, My dad actually was fortunate because he was offered clinical trials as part of his treatment. They should be considered a treatment option for all people who are eligible, and I'll get into that more a little bit later. But he was offered, and my dad, he trusted my uncle, right? That was his brother, his best friend, someone he'd known since they were children together, someone who he went from one country to another together, who had been through the culture shock of coming to the US as folks from an impoverished background back in Haiti, right? And so he asked him not only his medical opinion, but tell it to me like I'm your brother. Tell it to me like I'm someone that you care about, whose best
Yeah.
you have at heart. Be honest with me. Is this something I should consider? What are the risks, right? Because everything has risks. But again, what are the potential benefits? And I can't speak for everyone, and I'll be clear there. I don't ever want to overgeneralize when I'm making statements about the potential benefits of something or the potential risks. But I know that in my dad's case, and as you read in the op-ed, it did, we believe, help to give us just a couple years extra with him, right? His prognosis wasn't great, but because of his participation in the clinical trial, we had more time with him. I had more time to just spend not only as a caregiver, but as his daughter. My relatives also had more time with him as well. And so I'm grateful for that. Again, I recognize that that's not going to be everyone's experience, but the chance at that, the chance at spending more time with someone, the chance at someone's quality of life also potentially being improved, right? And we talk a lot about some of the side effects, but we don't talk about the potential quality of life improvement. I'm very, very, very grateful for not only his willingness to participate in the clinical trial, but also my uncle's guidance and the willingness that he had to take time to talk to him about it.
Right, right. So I guess how did, going through that and like witnessing like your father like just go through what he did, how did that impact your current career in, cancer support and helping guide people to the proper treatment that they need?
Really, it was life changing. It was trajectory changing for me when my dad was diagnosed. I was a senior in undergrad. I had big plans, as they say, to go to law school, and I was going to go corporate. I kind of had in mind what I was going to do. I was fortunate enough to secure a summer associateship after my first year of law school. I was moving in places and spaces where a lot of people didn't look like me, where I had some mistrust myself and some, I'd say, concerns about my ability to navigate these spaces where people didn't always look like me and have my background and my experiences. And so, with that, while my dad was in treatment and getting treatments, I was serving as his caregiver. I was also under the stress of law school. I started to see a wonderful therapist, and she really encouraged me as, my dad started to not really do well and eventually enter hospice. She encouraged me to think about what I wanted my life's legacy to look like. As I was watching my dad's life come to an end, what did I want to be able to look back on in my experience? And it was through those conversations, and it was also through, unfortunately, losing my dad, that I recognized that I didn't necessarily want to spend my life as an attorney. And I have great respect for those who practice law. This is not a diss or any shade to them, but I knew that I wanted to help people in a different way. And so I explored instead clinical psychology, clinical counseling track, got my graduate degree. I would like to think actually that my dad, in certain ways, kinds of smiles on me. I'll give an example. The day that I received my letter that I had been accepted for licensure as a licensed professional counselor was on my dad's birthday. So, little
Wow.
ways that right? Little ways that I would like to think that he winks at me. My cancer support community, we have to have a business related card, and the security code is the date of my dad's memorial date, so the month and day.
Wow.
Little things like that, right? So,
Yeah.
definitely impacted the direction that I took. And I recognize in doing more direct service and being a counselor earlier in my career, it's really hard to talk to people about their thoughts, feelings, and beliefs when they're concerned about where the rent is going to come from, or when
Mhm.
they're concerned about where their next meal is going to come from, right? Or who's taking care of childcare while they get to the next appointment. And so with that, I started to shift more into the public health, health equity space, keeping my clinical background in mind, making sure that we have trauma informed care and programs and we're not re traumatizing people through their cancer experience, but
Yes.
also being able to figure out programs and initiatives that we could pilot and expand to help people in the both physical health needs and also emotional well being.
That's great. I kind of resonate with your story regarding, how personal experiences can really, shape your career trajectory. Like my grandmother, she passed away in a hospital setting due to like a very serious condition that runs in my family. And that kind of really pushed me even more towards being in the healthcare journalism space and helping
Mhm.
provide people with the information that they need. So I just really resonated with that.
Yes.
So I do want to move into the medical mistrust and distrust factor that goes with clinical trials, especially in the Black community. So, you mentioned, your father and your uncle being Haitian and, coming to America and just kind of seeing how America really treats, Black and Brown people. So, what were some of those elements that you might have, understood, with your own cultural background with dealing with your father's distrust in clinical trials?
Yeah. So, part of it was that identity as an immigrant. There's been recent research published, and this is nothing new, but I think in the Black community, we also have to consider our spiritual beliefs. And I
Mhm.
won't overgeneralize here because not everyone is church, not everyone necessarily identifies as a Christian. But when it
Right.
comes to having some sense of spirituality or ideology, um, you know, small sample size, so I don't want to extrapolate too much, but recent studies have suggested that in at times, Black community more so than with other races and ethnicities, our spiritual beliefs also cause us to be skeptical of clinical research, right? The belief
Mhm.
that really it is God or the universe who is in control of my fate and my outcome, not necessarily research or the research study or participating in it. And so what I wanna be clear about with that, though, and with that statement is that that doesn't necessarily mean that people won't participate in a clinical trial, but it is a difference in beliefs. It is something that could contribute to initial reticence or hesitation. There are other things, though, that really contribute to us not participating as much in clinical trials or being skeptical of it, right? That has to do more with social and structural determinants of health. If I may, I would like to get into that, but if you have more questions about this, I'm happy to pause.
No, that's really interesting actually, because in a lot of research and just a lot of other advocates that I've spoken to in the clinical trial space, they mention, going into the churches, like helping people understand that, God isn't against you finding ways to get healthy. So
Mhm.
that's really interesting that you touch on the spiritual aspect. And I can especially understand that, in the Black or just like the Black diaspora as
Mhm.
well.
Mhm. You know what? No, we'll go with that, right? I'm glad you mentioned it because cancer support community, as I mentioned, we have Research and Training Institute, right? We've done research in this space looking at factors fueling medical mistrust, not only for Black and African American community, but for other communities of color. Also, our folks who live in rural communities, right, who often feel forgotten, who come in all races and ethnicities. Also, for people in the LGBTQIA plus, excuse me, community who often feel discriminated against by healthcare practitioners or disenfranchised. What I want to highlight here is that when we spoke with these patients and when we spoke with Black patients specifically, what we found was that yes, if you have a trusted messenger, if you have someone like you mentioned who is a faith based or a community based leader who is trusted to have vetted the information, right? Who recognizes when someone is coming into the community and it's supposed to be transactional when it should really be relational. If we
Right.
trust those leaders in our community to kind of do the vetting for us, and then we take a step back and we're willing to listen, yes, people are more willing not only to participate in clinical research, but also in screening and prevention efforts as well.
Definitely, definitely. So I do want to bring up the education aspect. How can we properly educate people around clinical trials without pressuring them to participate?
Yeah, so good question, right? Because we don't want to coerce anyone. I think it's really important. And if you're familiar with the 7 habits of highly effective people, we have to really begin with the end in mind here, right? Our
Mm,
goal is always to inform so that folks can make an informed There's been talk about whether we want to use the term empowered. Some people feel that empowered can be paternalistic. Some people actually like the word empowered, but I'm going to use it here, right? An informed and empowered decision to be equipped with the right information so that we can decide whether or not clinical trial participation would feel right for us as individuals. And so when we talk about educating the Black community, we want to, again, it's not about entrapment, rather, it's about empowerment, it's about equipping. We need to really focus on true community engagement, which I touched on before a bit, right? Conversations about clinical trials and the risks and benefits actually need to happen regularly and repeatedly. It can't be a one off, hey, I'm coming for youth week or whatever, or Women's Day, and I want to talk to you about clinical trials as like a 10-minute aside in the service. It needs to be a consistent relational interaction. And this takes time to build trust. When we're writing out these proposals for programs or we're building out project timelines, we have to recognize that the outreach and the engagement and the education phase is going to take months, if not years, for certain communities. Because again, their experiences of being mistreated, the injustices, they're not only historical, they're contemporary. They see how the system is mistreating them. And so we have to work to not only address that, but then provide the education as well. Have these community members recognize that they are partners. We are doing things alongside and not just about, we're doing them with and not just for. And I think it's really important, again, that we underscore that this takes time. That's part of it, right? You don't want to coerce anyone, you want to educate, you recognize that it takes time, but we also have to look to other leaders. I'm talking about the Pan-Hellenic Council, right? I'm talking about our HBCUs. I'm talking about the Congressional Black Caucus. It's not just faith-based and community-based organizations per se. It's these other national organizations with reach into hyperlocal communities that we have to be willing to engage because we recognize that they also are trusted and we recognize that they have doctors and providers and nurses and nurse practitioners within each of those entities that can also help with educating. And finally, I think it really is about humility, right? I think sometimes people get irritated or frustrated when someone has a lot of questions or when they're
Yeah.
skeptical. But that's
Mhm.
what I put my clinical lens on, right? What happened that causes you to have so many questions? What happened that causes you to have so much mistrust or so much reticence about this? There's a reason. Again, it's justified. And if we're willing
Yeah.
to be humble enough to listen to the questions, to not be dismissive of them, to not be academic elitists about some of the questions or some of the myths that exist within the community about clinical trials and clinical research, we're willing to really sit down and have those bi-directional conversations. I know I'm doing a lot of talking now, but I'm willing to answer questions later, right? Bi-directional conversations with people, I think that's where we build the trust and we actually genuinely educate. And again, have the willingness to take a step back and say, okay, here's the information, here's the objective information. It is up to you to make a choice based on what you feel would be best for you.
Right. It's about giving people the opportunity to make that decision for themselves. So
Mhm,
it's
mhm,
wonderful. So you mentioned, that justified medical mistrust, and that's actually the name of the docuseries that you worked on. So
mhm.
can you first tell us what exactly went into that docuseries?
Absolutely. So, a little bit of background. I mentioned that we've done research. We've also done a couple of years ago, back in, I want to say 2021, but the research was presented in 2022. We actually surveyed Black multiple myeloma patients specifically. So the sample size here was close to 200, 196, 197, but these were Black patients living with multiple myeloma. For those who may not be familiar, multiple myeloma is a type of blood cancer. We have a higher disease burden than our non-Black compatriots, higher incidence and prevalence, but also higher mortality rates as well. We tend to be diagnosed at later stages when compared with our white compatriots as well. And so for multiple myeloma, we specifically asked, what factors cause you to want to participate in clinical research or what is stopping you? And what we found, top three concerns were I don't want to be used as a guinea pig in research, right? I also have financial and logistical concerns that I feel would need to be addressed. And I want to be clear and have things explained to you by a member of my care team in order for me to feel more like I would trust this process or participating. And so with that, my predecessor at CSC started to think more about other factors that fuel medical mistrust and how we could really address this in a format that's digestible for folks. And so
Mhm.
when I joined, I worked on this project, Justified Medical Mistrust, Acknowledging the Past to Change the Future. It is a six-part, free. Again, we're all about accessing things for free. We don't ever want to paywall life-saving information, but it is a
Right.
six-part docu-series that looks at not only historical causes of medical mistrust in the communities of color and the Black and African American community, but also contemporary experiences, talks about that, but also talks about what is the medical community doing to earn trust, right? The onus
Mhm.
is not just on me. If I'm the actor who doesn't trust you, then what are you doing to ensure that that trust is earned and maintained? I love what we've done in terms of featuring past clinical trial participants from the Black and African American community who are willing to, in these short, they're about 11 to 13-minute videos, talk about their experiences in clinical trials for cancer. We also feature Black doctors, right? So, hematologists. You think of them as blood disorders, but they work with multiple myeloma patients, for example, and oncologists who can talk not only as healthcare providers, but also as people who are also from communities of color, moving in these spaces, understanding in their own families what some of the myths might be or what some of the concerns that are very valid might be about participating in clinical research. We filmed two of the six so far. So that's How Does a Clinical Trial Benefit Me? And What is the medical community doing to earn trust? Our next film will go into production early next year, and we're going to be looking at myths versus facts, two sides of the same coin, right? Am I going to get a sugar pill or a placebo? What does it mean if I'm in the experimental group versus the control group? What is standard of care? And one of my favorites, which is actually more so directed at healthcare providers and industry, which is if we build it, they will come. Not necessarily true. Where are you
Mhm.
building it? Right?
Right.
Have you considered the needs and concerns of people that you actually want to participate? But looking forward to that. And the series is available on our website, but also on YouTube for those who just prefer the YouTube experience.
Yes, and we're going to have a link to this docu-series in the comments once the
Mhm,
show is over. But
mhm.
I do want you asked a very good question. What can the medical community do to earn trust? Like what are they do since they're not doing enough right now, obviously, what can be done? I want to hear that in your own words.
Yeah, good question. So I'll give an example that's featured in the film, but really it's about, again, going back to those partnerships that are long term, that are consistent, that are about building relationships and not just transactional one offs. So I'm thinking of one of the people who was featured in our film, and that's Dr. Karen Winkfield. She's a Black woman radiation oncologist. She leads the Meharry Vanderbilt Alliance. I don't want to assume. So, for anyone who may not be familiar, Meharry Medical College, right, considered an HBCU, but on the medical side. So, School of Medicine, nursing, and other allied health professions there. And then Vanderbilt University in Tennessee, a larger PWI, if you will. And so they have built a partnership together to really engage the local community, not only around the benefits of clinical trials, but really just about health in general, which I think is important. Don't be so hyper focused on getting people to participate in clinical research. Are you concerned about some of their other disease states? Are you concerned about the fact that they don't necessarily have access? There are food deserts, for example, they don't necessarily have access to healthy and nutritious foods. And if you are offering healthy and nutritious foods, is it culturally sensitive, right? When
Mm.
I worked with the city of Philadelphia, often what we would hear from patients from communities of color was that yes, they got a food box, or yes, they were able to go to the food bank, but they didn't have anything that they actually would eat, like ethnically or for their own culture. I'm thinking back to my dad here, right, as a Haitian immigrant. Don't tell him that he's not going to be able to have rice and beans with his meal or offer him something that's
Yeah.
like, I don't want spaghetti. I don't want macaroni, like, certain food pantry staples that could also be shelf stable if you would just think about the cultures who are using it, like rice. But with that in mind, Harriet Vanderbilt Alliance does a lot of work in this area. They have community event days. They have meetings with leadership, but also with patients. If you go to their website, it's very clear that they have thoughtfully and intentionally from the beginning included the community, not only community leaders, but actual patients and their loved ones in the process, because they recognized that it was going to fail if they didn't include them. Dr.
Mhm.
Wingfield was just wise enough and brilliant enough in a previous institution that she was at, but with community partnerships to build trust, thought about racial and identity and ethnic concordance. So, in other words, making sure that the person who's engaged in the community actually looks like the community. And so they use for three different communities navigators that were from that community racially and ethnically. And they had an increase in clinical trial enrollment by 50%, 50, as a result of just making sure that the person you're talking to looks like you. We recognize not, there's a saying in the community, not all skin folk are kinfolk, but it helps, right? It at least helps you let your guard down a bit when you walk into the room when your provider looks like you, or you can talk to someone about it who looks like you, as with my dad.
Right, that representation matters so much, and it's great that you were able
Mhm,
to include, Black doctors and Black participants in clinical trials in the docu-series that you created, so that's
mhm,
amazing. I want to
mhm.
move into financial considerations. I know that's another big aspect that can be considered a barrier to clinical trial participation. So, what are
Mhm.
some solutions, I guess, particularly from cancer support community or just anything that like in your own arsenal, like working from this? How can basically what are some solutions to alleviating some of these financial barriers to clinical trials?
Love these questions. Want to just underscore here that financial barriers that exist to clinical trial participation are not necessarily unique to Black and African American patients, right? Many folks experience the cost burden associated with not only cancer treatment, but wanting to participate in clinical research. And so these do include the cost of transportation to and from the clinical trial site, if we're talking about clinical trials specifically, parking fees that might be incurred, time or wages lost for those appointments and to attend those appointments, elder care or child care needs. We often think about child care needs, but many cancer patients are caregivers for their older loved ones. So, elder care needs, and also sometimes, depending on how far you are, calling back to our rural community members, right? Hotel expenses and lodging. And what I need for clinical trial sponsors to understand, and I can talk about CSC's resources in a moment, but for the clinical trial sponsors, if any of you are watching or listening, my partners in industry, right? You've really done your best already to incorporate your work into cancer centers, and we appreciate that. I think it's important to recognize that there's been a lot of work done around making sure that clinical trial appointments actually coincide with these regularly scheduled appointments with the care team so that the patient isn't going in for extra appointments. It's all done in one visit. Um, there are vouchers that are often offered for reimbursement for transportation and parking fees and things like that. But I do want to encourage our interest holders to remember and recognize that vouchers and reimbursement tend to work best for people who already have the money, right? Who can put that money up front. If a person really wants to participate in a clinical trial and you really want that representation, but they are impoverished, then it's not going to work to reimburse them. What really works is prepaid parking for clinical trial visits, prepaid, right, vouchers, something that is given up front so that the person doesn't have the added stress, the added anxiety of how they're going to float this on their credit card or how they're going to float this expense until it is reimbursed. Goes a lot farther. As far as what clinical trials can offer more generally, there's this notion of the decentralization of clinical trials. Decentralized clinical trials, or DCTs, really is a way to offer a clinical trial that has one or more of the components that actually take place outside of a traditional clinical trial site. So it might look like having monitoring via the phone. A nurse or a care team member calls you to get a report on your symptoms or if you're having any side effects. Someone might be able to visit the patient's home instead of the patient having to go to them. A lot of it is also allowing for lab work that happens near the home instead of at the clinical trial site. This can be really helpful. There's been a strong support for DCTs, especially again in rural areas where there's only one or two clinical trial sites for the entire state, and you're trying to really reach and help more people. That's another thing that can be done more structurally. Cancer Support Community offers a variety of free resources in addition to that psychosocial support that I mentioned. So we have a helpline. This is free, what we call proactive navigation. We have specialty navigators. We have a clinical trials navigator. We have financial navigators, right? Who are able to, they've been called magicians by some of my colleagues at other patient advocacy groups. They're able to help with getting grants for utility assistance, rent assistance, food assistance. We offer this service in both English and Spanish. We also have translation services and are careful about the translation services that we use to make sure that we're able to still be culturally humble and culturally competent in our interactions. I'm really proud of the work that our helpline does. I have to shout them out. But when it comes to addressing some of those logistical and financial barriers, not only to treatment in general, but also to clinical trials, our helpline team does a wonderful job at it.
That's great. That's great. And you touched a little bit on, trial design and being culturally sensitive. So, how can clinical trials in by design make themselves a little bit more culturally sensitive and inclusive, especially for Black people?
I keep saying great question, but they really are great questions, and I'm happy that you're asking them. So, I think some of us might be surprised to learn that there are many people actually in the pharmaceutical industry. I am so sorry. My notifications are coming in. Pharmaceutical industry, some folks may call it big pharma, who are really interested in making clinical trials more inclusive and having that representation, not just so that they can check a box. It's not performative. I interact with these folks on a pretty consistent basis. They genuinely care. They recognize that disparities exist. They recognize it's infuriating, right? That people who look differently or have different melanin content or live in certain zip codes are not being treated the same and having access to the same cutting edge innovative technologies and therapies like for my dad, which could extend their lives, which could improve their
Exactly.
lives. So I say all that to say, and that's my soapbox, many people in the pharmaceutical industry are interested, right? And so there are groups, the Association of Cancer Care Centers, also known as ACCC. They're not pharmaceutical representatives, but they have something called a CORI, and that is ACCC's Community Oncology Research Institute. And that was developed to address the fact that cancer clinical trials do fail to adequately represent the diversity of the cancer patient population. So a few weeks ago, I had the pleasure of attending the ACORI annual summit in Washington, D.C., where members of our pharmaceutical industry were present. And we talked as a group about things like, as I mentioned, decentralizing clinical trials, how important it is for clinical trial sponsors to recognize the value in DCTs. We also talked about the importance of recognizing and acknowledging medical mistrust along different parts of the continuum. So, not just with the healthcare provider in the exam room or at the infusion center, but also the mistrust that exists for pharma, right? And what can we do
Mhm.
about that to help people understand that there are folks who genuinely want to be able to help? They do. They being pharma, when we're talking about transparency, spend a great deal of time and care to ensure that the patient voice and experience is represented and reflected in their work. I have had the honor and pleasure of elevating and amplifying our patient voice by participating in meetings and on advisory boards where they develop those informed consent forms that are used as part of the clinical trial process, have asked and been able to ask very candid, pointed questions about the wording of some of these documents, whether they think anyone who doesn't have a PhD is going to be able to understand what it is that they said in the informed consent form, and also giving feedback about clinical trial protocols and whether they make sense for real patients and for patients who look like me or patients from different communities. They're doing their best, and I would say for some, beyond their best, really trying to ensure that our voice is included at all points in the process, even when they're developing the documents associated with the clinical trial experience.
Sorry about that. Had a slight hiccup here.
No worries.
Okay. That's great. So I know that your father's story is kind of, I won't say an exception or even particularly unique, but I feel like his story should be the standard as far as Black folks getting the treatment that they deserve when it comes to cancer care. So can you speak to any other like great clinical trial success stories that you've heard? At least I'm sure you've heard many, but can you speak to one that really stands out to you from your work?
Sure. And I think here I'll give you a programmatic example as well. Cancer Support Community has a program called the Peer Clinical Trial Support Program. And here, this is an excellent example because we train past Black clinical trial participants in the evidence based peer model to be able to have conversations with Black cancer patients who might be interested, right? And I say might be interested because, again, we want to equip people with information. We want them to have their sense of agency and autonomy about whether or not they're going to choose to participate in a clinical trial. But at the very least, they want to have a conversation or two to talk about it, to ask questions, to learn more. And so our pilot for this was about 10 months. It was IRB exempt. And what we found was that a significant increase in willingness to talk to your care team about clinical trial participation. Every If you look at the percentages, everyone who participated in it no longer walked away with the sense that they would be used as a guinea pig for research, right? They had a better understanding of the fact that you wouldn't get a placebo or a sugar pill, you would get the standard of care. What is the standard of care? It's actually the best treatment that's available for your cancer type and for your diagnosis right now. So if you're not getting the experimental treatment, you're still getting whatever the best available treatment was. They understood some of the disadvantages, potential disadvantages, side effects, right? But also understood that with side effects, I think there's an assumption sometimes that, oh, if I participate in a clinical trial, I just gotta stick with it, right? Like, no, they're calling you, as I mentioned, for the decentralized clinical trials or at your visits. They're asking you about your side effects because oftentimes the dosing can be managed. You can still participate and you don't have to suffer through it. You can say, and you need to be honest. That's another thing that I always remind people, please be honest with your care team about your side effects. They can usually titrate or adjust your levels of the medication or of the treatment. But we talked with them about that as well. Peer clinical trial support program is a great example because we have peers in that program who have benefited from clinical trials themselves. But one of the women, one of the peers, is featured in our first Justified Medical Mistrust film. So, how does a clinical trial benefit me? And that is Miss Lisa Dutton. She actually started a clinical trial, breast cancer survivor, started a clinical trial in the surveillance arm. Another thing that I want to underscore, there are so many different types of clinical trials. It is not just treatment trials that you can be a part of. You can be a part of something called a surveillance trial, which is basically, hey, we know that you have this diagnosis. We would like to have some issues about surveillance and the implications there, right? But we would like to monitor how you are doing with the progression of your particular disease or cancer type. We're just going to monitor it. We might ask you to come in for scans every 3 months or every 6 months or annually, but we just want to see because Lisa had been in remission because she was in the surveillance arm earlier ahead of time. She was able to learn actually that the cancer cells had returned, right? Now, she had just been going for her regular scheduled appointments. That actually would have happened later. So the cancer cells would have been growing in that time period. Surveillance trial, though, got her the benefit of getting ahead of it. Once she found that out, she was moved over to the treatment side, which she had taken, I believe it was an oral pill that she talks about. Side effects for her were some aftertaste that she said was manageable, and her, just an aftertaste, which happens sometimes with medication, right? But she believes that as a result of her participating in that treatment trial, that she is within the vast majority of patients who saw a reduction or complete removal of their cancer cells. So for her, not only surveillance trial caught it earlier than she would have, but then treatment trial cancer cells gone and have been right upon follow up a couple years later. She, I think, is another success story, right? Life saving, life saving. Were there side effects? Yeah. Funky aftertaste. Had to drink more water. I'm not dismissing that, right? It can be annoying.
Mhm.
However, the benefits are also there as well. Caught her cancer return earlier and ended up now, as a result, not having the cancer cells continue to grow. So, People can take that for what it's worth, but I think she's a great example. There are others. I will share that we are now preparing to initiate the Spanish speaking version of Peer Clinical Trial Support Program for both
Great.
monolingual and bilingual Spanish speakers, which I'm really, really excited about. We know that folks in the Spanish speaking community, who, as we know, can be Afro Latino, right, as well
Mhm.
in the diaspora, can also benefit from clinical trial participation as well. And we recognize the nuances with needing to culturally adapt, not only having translated materials, but culturally adapt so that folks from different ethnicities in the Spanish speaking community feel comfortable.
Yes, and I mean, Lisa's story just goes to show, like, clinical trials are for us. It's not something that we're just not that we're meant to sit out on the sidelines for, so thank you so
Mhm,
much for sharing that.
mhm.
I know we're coming up on time a bit, and of course, to our viewers, if you have any questions for Audrey, feel free to drop them in the chat here. But I just want to say, like, what are your hopes and vision for the future of clinical trial participation in the Black community? Like, what are some steps that you think need to be taken?
Yeah, so I mentioned this a bit in the op-ed, but I do still maintain my position on the matter. It really is my sincere hope, it is my vision, it is my prayer, really, that Black and African American cancer patients and their loved ones, right? Because we're not operating in a silo, loved ones and caregivers and care partners are part of the calculus, that we consider participation in clinical trials as part of our treatment options from the moment that we receive a cancer diagnosis. We recognize, just like chemotherapy or radiation or other options may be on the table, we should be asking, and I don't say should as in a paternalistic, you should do this, wagging my finger, but as in a should feel comfortable and feel equipped. And again, I'm going to go back to empowered to be able to ask, hey, why didn't you mention a clinical trial to me? Right? Because I'm interested. We should have that confidence, not only in the clinical research process, but also in those who have gone before us, who look like us, who have participated in clinical trials. In some of what I've just shared, like the fact that our pharmaceutical industry partners really do want our opinion about the informed consent process and the documentation and the globs and globs of information that we're going to have thrown at us when we want to participate in a clinical trial. I say that as a good thing, though. It's a lot of information, but I'd rather be blinded with light than darkness, right? They want to be transparent, they want to be upfront with us. I do desire that we confidently advocate for those clinical trials, as I said, but it's so that we can make those informed decisions and consider everything, not necessarily in a vacuum or siloed, but compare and also revisit, right? Maybe when we first receive a diagnosis, we may not be interested. We're trying to just digest what is the new normal. But 6 months down the line, our provider asks us again. That's the onus is on the provider there again, right? They keep revisiting the conversation, not to be annoying, but because they recognize how helpful it could be. We're willing to maybe explore it then. And I want to just highlight that, without our participation and inclusion in clinical research, the drugs, the treatments that are being developed might not actually help improve our, and when I say our members of the Black diaspora, improve our quality of life or prolong it because the researchers won't actually have the opportunity to see how we specifically respond to these treatments. And if we want to achieve greater equity and inclusion in clinical trials as a society, I think there are some steps we can take. We can assess, we can change, we can advocate for policies, both political, organizational, and institutional, that actually improve access to clinical trials by mitigating those social and structural determinant of health concerns that I talked about earlier, those barriers to care, those financial and logistical concerns. We can work together with each other as different interest holders and alongside our allies who may not look like us, but who actually do have our best interests at heart, to be honest about our health status, right? Our health status with each other. If I receive a cancer diagnosis, I want to tell my relatives. I don't want to hold that in shame. I don't want to hold that in guilt because that can be life saving information if someone else
Right.
knows in my family that they're at risk, right? But we can
Exactly.
be honest about our health status. We can be honest about when we do participate in clinical trials, what our experiences were, good, bad, and indifferent. We can also hold each other accountable in love and care to also follow up on our symptoms, to be able to share those experiences and be humbly, again, willing to answer questions from folks and listen to critiques, right? I'm all
Mm.
for critical thinking. I love being able to have that dialogue. It helps me think more. It helps me to also better plan educational resources and programs that are going to help people because I recognize even more the lens or the concerns that people have. I think we need to again acknowledge not only the historical injustices, but also those contemporary experiences of racism, right? Racism is still very much real. It's still embedded
Yes.
within the healthcare system. And we can have meaningful conversations among faith based, community based, industry, healthcare, and other leaders about what it means to truly trust someone and is with my dad's case with my uncle to feel safe in their care. When you feel safe, you're willing to confidently explore, I think. So that's just a couple of tidbits of what I would hope for and what my vision is.
No, that's amazing. And you bring up a very great point about not being ashamed of your illness. Illness is something to never be ashamed about or feel any stigma around. And, like you said, sharing that and really finding those people that can rally around you and get that support can be life saving. So, thank you so much, Audrey, for your time. How can our viewers reach you?
My pleasure. So I am at cancersupportcommunity.org. If you go to About Us, Health Equity in Action is like the second there, but I'm happy to share. I guess I can join the chat, right? Nope,
Yeah.
it wants me to connect to something
Oh,
else. Okay, I'm happy to share my email address. I think it's at the bottom of the op-ed as well. I
mhm.
am on LinkedIn. I'm not really doing Facebook and Instagram as much these days. I don't know if it's reflective of my age or just how busy I am, but I'm definitely reachable via email and also on LinkedIn.
Now I get you. Social media can definitely be a lot. But yes, thank you so much, Audrey. And as a reminder, we're going to place links to the Justified Medical Distrust docuseries in the chat, as well as a link to Audrey's story on BDO. And thank you again for being here and chatting with us. And you have a lovely day.
My pleasure. Thank you.
Thank you. Bye.